Welcome to this explainer. Look, we know firsthand that navigating male infertility can feel overwhelmingly stressful, lonely, and frankly just incredibly confusing. When you're trying to build a family, hitting unexpected medical hurdles is really tough. But I want to tell you right off the bat, you are absolutely in the right place. Today, we're going to clear up that confusion and hopefully replace it with some real clarity and hope. We'll be using direct, factual insights and medical data from the specialists over at ART Fertility Clinics to guide us through this entire journey. Okay, let's dive into this. When you or your partner first hear a doctor say the words azoospermia diagnosis, the immediate, sometimes terrifying question is usually, well, what does this actually mean for my family? Is natural fatherhood completely off the table? I want to validate that anxiety for you right now. It is completely normal to feel a wave of panic when faced with a clinical term that you've probably never even heard before. But as you're going to see today, this diagnosis, it's not the end of the road. Actually, it's really just the starting point for a different, medically supported path. We're going to break this whole thing down step by step so you know exactly what your options are. So here's our comforting little roadmap for today's explainer. We're going to start off by just understanding azoospermia, and then we'll move right into the causes and hidden signs. After that, we'll look at the impact on fertility, explore the exact steps for diagnosing the blockage, and finally, we'll wrap up with the pathways to treatment. All right, Section 1, Understanding Azoospermia. What exactly are we dealing with here? By definition, azoospermia is the absence of sperm cells in the ejaculate regardless of regular sperm production, which the medical world refers to as spermatogenesis. I want you to think of this literally like a giant roadblock on a highway. The factory, meaning your body, is still manufacturing sperm perfectly well. Production is active, it's normal, and it's healthy. The issue is simply that the cargo is hitting a physical barrier and just not getting through to its final destination. Now, what's really interesting about this breakdown is who actually experiences this condition. According to ART Fertility Clinics, azoospermia affects about 1% of the overall male population. And of that specific group, 40% of those cases are classified as obstructive azoospermia, or OA for short. That's the roadblock scenario we were just talking about. The other 60% are non-obstructive. I'm pointing this out to say, if you are dealing with obstructive azoospermia, there's absolutely no way you are alone in this. This is a highly documented condition that fertility specialists see, treat, and understand intimately. Moving right along to Section 2, Causes and Hidden Signs. Why does this actually happen? Well, there are 4 primary underlying causes for this blockage to occur. First up is a previous history of a vasectomy. Second would be a physical blockage located right in the ejaculatory ducts. Third is a history of infections in the testicles or the epididymis, and fourth is a congenital absence, which simply means you were born without an epididymis or a vas deferens. To keep things super simple, the vas deferens is really just the internal tube responsible for storing and transferring the sperm. It is essentially the actual highway that a roadblock is sitting on. You know, a lot of patients wonder how on earth they could possibly have this condition without ever knowing it. Let me reassure you on this one. It is completely 100% normal to have felt totally healthy and fine your entire life. There are generally no noticeable day-to-day symptoms of obstructive azoospermia. The primary indicators are purely clinical, specifically difficulty producing sperm or having obstructed ejaculation. These signs are entirely hidden until a couple faces difficulty conceiving and then proactively seeks out testing. Okay, Section 3, the impact on fertility and the challenges with conception. So the crucial point is this. The reality we have to face is that because the ejaculate lacks sufficient sperm, natural conception is going to be very, very difficult. And I know that's a really tough hurdle to accept. Yes, natural conception is a serious challenge here. But, and this is a massive, incredibly hopeful but, because your body is still actively producing sperm right behind that roadblock, successful retrieval of healthy sperm is highly possible. Medical professionals can literally just bypass the block entirely. And once retrieved, these healthy sperm can then be utilized for IVF or other advanced fertility procedures. Let's look at Section 4, Diagnosing the blockage. How do doctors actually test for this? Diagnosing obstructive azoospermia is actually a really straightforward, logical 3-step process. Step 1 is a physical assessment, where doctors check the physical structure of the testicle and epididymis to spot any inappropriate structures or abnormalities. Step 2 involves imaging tests, specifically a prostate and scrotum ultrasound, just to get a crystal clear visual of what's happening inside. And finally, Step 3 utilizes clinical hormone tests.
Your medical team is going to check your levels of testosterone and follicle-stimulating hormone, or FSH, because those specific hormones have a direct impact on your sperm levels. It's just a precise checklist, perfectly designed to locate exactly where the issue lies without any guesswork at all. Which brings us to the final and most hopeful part of our roadmap. Section 5, Pathways to Treatment. How do we treat it?
Depending on where your specific blockage happens to be located, there are two main surgical procedures used to treat this condition. First, there's vasovasectomy or vasoepididyomostomy. This procedure involves a small incision in the testes to clear the barrier specifically in the vas deferens or the epididymal tube. On the other hand, there's TERD, which stands for transurethral resection of the ejaculatory duct. With this one, a small incision clears a hindrance directly in the ejaculatory duct, which is responsible for the ejection of sperm. And this brilliantly illustrates just how tailored fertility treatment is today. The specific procedure is chosen to perfectly target the exact location of your unique roadblock.
I really want to wrap up the clinical part of our journey today with this exact quote directly from the medical experts at ART Fertility Clinics. Regardless of this low sperm count, successful retrieval of the healthy sperms can be done from the testis or epididymis. Honestly, that is the absolute fundamental takeaway you should hold on to here. The barrier is physical, sure, but the potential for life is still right there, just waiting to be safely retrieved by the pros.
And that brings us to our final thought, and a pretty vital question for you to consider. Knowing that healthy sperm can still be retrieved, what steps will you take today on your pathway to fatherhood? Having the facts is literally the best way to conquer fear. You're now equipped with a clear understanding of what obstructive azoospermia is, how it's diagnosed, and most importantly, how it gets treated. The next step? It's simply reaching out for a consultation. Thank you so much for joining me for this explainer. I really hope this structured look at the facts has given you some much-needed clarity, and I wish you the absolute best on your journey ahead.